Gage Primar here, crushbackpain.com. Today we're going to look at some higher level core stability exercises. We've talked in the last two videos about the foundation core stability exercises. Once you've got those dialed in, once you've done those for a month or two, your back is less painful, you're feeling better, then you can progress to some higher level, more functional core stability training. The three drills that we're going to look at today are the push-up. The push-up is an often overlooked core stability exercise. If done correctly and done with engaging the trunk musculature, it's a great core stability drill. We're going to look at the abdominal walkout, which is basically a push-up on steroids. It takes a lot more stabilization. And then we're going to look at the single leg hip hinge or single leg deadlift, as some people call it. Again, higher level, takes some balance, but the entire core has to be active to stabilize that lumbar spine and keep it neutral. Let's look at the push-up first. Like I said, super popular exercise. Obviously everybody knows how to do a push-up, but if you're doing it for core stability reasoning, you want to make sure that your back isn't too arched. You don't want to be here. Basically what I like to have people do is get their spine where it's comfortable, lock it in, get real tight in your abs and your glutes, and then down and up, down and up. So you're doing a push-up, but you're not going to get a lot of motion in your lumbar spine. What you'll notice with people doing push-ups a lot of the time is their back arches quite a bit. They get quite a bit of extension, or they're up like this. You want to keep that spine neutral, really engage the abs, and just down and up. So as you become fatigued, that'll get more difficult to do. You can do reps to substitution. That just means you're doing reps until you feel that lower back start to move into too much extension and you're trying to flex it too much. You know, you can do 10 reps, 15 reps, 20. Everybody's a little different, but the key is that lumbar spine's locked in, it's stable. Push-ups are a great core stability exercise. Now the next one would be a progression from the push-up. It's an abdominal walkout, and basically you get in the push-up position, you walk out with your hands and walk back. With this one, you want to just really lock the core in, just really tight, get that abdominal brace on. And as you walk out, you want minimal motion through your lumbar spine. You are going to get some movement, that's okay, that's normal, but you want to control that movement with the abdominal musculature. So for the walkout, let's see here. Again, you get in that push-up position, get your back where it's comfortable, get it dialed in, and then you literally just walk out, stay tight, and walk back. Okay, so that's what it is. You walk it out as far as you can, and you're walking back. Now, the farther out you get, the more your back's going to want to extend, and that's where you have to stay real tight in that anterior core, your rectus abdominis. So if you go out and that back extends too much, you're going to feel some pressure down low. I mean, that's not necessarily going to like damage anything or hurt you, but the less you feel in your lower back as you do that abdominal walkout, the less force you're putting through those lower lumbar tissues. So you know you're doing it right if you're able to walk out and you're not feeling a lot of pressure in that low back. And I really have to focus on that. Now, if you want to progress that, you can walk out, get back, push up. Walk out, get back, push up. Okay? Very effective core stability exercise. Great progression. Sets, reps. Again, reps to substitution. You'll know when you have to quit doing that one. Pretty straightforward. Everybody's different. They're going to work in a different rep range. Now, the last one is that single leg hip hinge or single leg deadlift. This one requires some balance, but basically we're having you stand on one leg, okay? And then again, you're getting your lumbar spine where it's the most comfortable, okay? I like mine there. And then you're literally just hinging through your hip. All the motion is through your hip. You are not bending forward through your lumbar spine. Hinge forward through the hip. I've got my left leg down, so I'm going to take my right hand, come down towards my left foot, just come down till you feel a pull in your hamstring, pull up. Come down till you feel a pull in your hamstring, pull up, okay? With this exercise, you're working the erector spinae musculature, the abs, the obliques, that whole trunk cylinder that stabilizes the lumbar spine. Plus you're working your glutes, that tie in to the thoracolumbar fascia. It kind of cinches up that built-in back belt. You're working balance, you're working the lower extremity strength. So you're kind of working the whole body at once. The key is, what people have a tendency to do is they'll either bend through the lumbar spine. This is exactly what you don't want. So I'm just bending forward through my back, getting repetitive cyclical flexion extension. We don't want that. The other thing people tend to do is rotate too much. So we're literally using the abdominal muscles to check rotation, check flexion, okay? So again, you're locked in, soft knee, slight bend in the knee. You don't have to have it locked out, soft knee, and you just hinge through the hip till you feel a pull in your hamstring. When you pull up, you tighten your buttock to extend that hip and pull you up. If you're doing these right, you're going to feel your hamstring and your glute. It is not going to hurt your lower back. You're not going to feel it in the lower back. If you're doing it wrong, you're either flexing too much through the lumbar spine or you're rotating too much, and you will feel that through the lower back. With that one, it just depends on how well you have it dialed in and how well you do with that movement pattern, but anywhere from 5 to 12 reps is appropriate, and I do 2 or 3 sets on each side. And again, that's going to have a lot of carryover just to everyday activity, everyday function. So you've got 3 higher level core stability exercises that you can work on after dialing the more basic foundational exercises in for 1 to 2 months. So you've got the push-up, the abdominal walkout, single leg hip hinge, single leg deadlift type movement. These are excellent movements because they don't require any equipment. You don't need to be in the gym, but they're going to challenge your core musculature. They're going to get your lower back tissues that much more able to withstand forces and activity. If you have any questions, drop me a line below. This video helps you, leave me a thumbs up below, and check back regularly for proven methods to beat back pain here on the Crush Back Pain YouTube channel.